Good evening, everyone. I am Dr. Ravi Sarvi. I am a consultant nephrologist and transplant physician working currently at KLE Hospital and working as associate professor in the Department of Nephrology. Since last 8 years, I am working in this place and medical college, that is Jawaharlal Nehru Medical College, Belagavi. So today we'll be discussing the topic edema. Edema means accumulation of the fluid in the extracellular spaces. Okay, or we call it as swelling of the particular organ. Edema can affect any organ. Okay, so depending on the where it is accumulated, we say peripheral edema or limb edema, where the fluid accumulates in the extremities of the body, like the pedal edema, where we say edema or fluid accumulation in the lower limb or feet. Okay, similarly, there is something called as cerebral edema, means fluid accumulates in the brain. That is called as the cerebral edema. Okay, that is one more type. There is another type that is called as lymphedema, means the fluid accumulates because of obstruction or damage to the lymph nodes. Lymph is the one which kills the bacteria and drains the fluid from the extracellular space to the blood space, and that is called, when it is obstructed, it can also lead to edema, that is called as lymphedema. So one is lymphedema, one is peripheral edema, cerebral edema. There is something called as pulmonary edema. That means fluid accumulates in the lungs because of lung condition or because of the heart condition, or it can be because of renal conditions or kidney situation. That is called as pulmonary edema, where the fluid accumulates in the lungs. So there is one more type of edema that is called as macular edema, means fluid accumulates, or the fluid accumulates in the eye, that is especially in the retina, that causes visual problem or difficulty in seeing the object. So these are the types of edema. Coming to causes can be depending on whatever I have discussed about the types. So simple causes can be because of a long standing, or a person stands for a long time, can have edema in few patients, not commonly in everyone, but it can be in few patients. That can be a cause. Pregnant ladies can have mild edema. That is one of the common cause in pregnant ladies we'll be seeing. So other conditions where you can edema see is patients with cardiac conditions. They can have difficulty in breathing or fluid accumulation in the chest, or they can have leg edema or pedal edema. Kidney problem again can cause swelling of the feet or limb edema. That can also affect the swelling of the face. That is called as facial edema. So it can be a kidney problem. It can be a heart problem. Similarly, liver diseases can also lead to swelling of the lower limb as well as abdominal distension. That is also a common cause of edema. Other causes includes, there can be a protein deficiency. The protein deficiency can also lead to edema, especially pedal edema can be seen. Okay, these are some common conditions. There can be local conditions which can also lead to edema. Limb edema can be localized to one limb, where there can be a damage to the lymph nodes or blockage of the lymph nodes or drainage system of the lymph nodes. That is called as lymph destruction, which can be due to any cause like the trauma to the limb or lymph vessels, or it could be during surgery, lymph nodes are dissected and that blockage of the lymph vessels, that can also lead to lymphedema, or trauma to the limb, which can lead to something called as cellulitis and swelling of the limb. That could be one cause of lymphedema. These are some conditions which can lead to edema. So when it comes to clinical symptoms, the symptoms depends on which part of the body is suffering from edema. Suppose when there is a limb edema, you see obvious swelling of the feet, and on examination you can see there is a pitting in nature. Means many times when you press it, it will give the indentation. That is called as pitting type of edema, which is usually seen in congestive heart failure or renal edema or problems with kidney diseases that can cause lymphedema. Similarly, if the kidney problem peculiarly presents with something called as facial swelling, or what is called as swelling of the face, especially in the early morning, because the individual lies in the supine position, and when he gets up, you can see that patient will have swelling of the face. And classically, it improves as the day progresses. That is called as facial edema, which is quite characteristic of patients with kidney diseases. The patients with heart disease and patients with especially pulmonary hypertension, they can have something called as congestive cardiac failure. They can have difficulty in breathing, especially when they walk for longer duration, or when they do heavy work, they can have facial edema. They can have breathing difficulty, which could be because of pulmonary edema, or it could be because of when they lie down, they classically presents with choking like sensation. So they try to sit, and that can relieve the symptoms to some extent. We call it as classically paroxysmal nocturnal dyspnea, that is PND. That is, individual will have more breathing difficulty when he lies supine or in the sleeping position. He will be having relieved of symptoms when he sits up. That is called as PND, or paroxysmal nocturnal dyspnea, which is characteristic of cardiac disease. We call it more like left heart failure. Similarly, symptoms includes like when the patient will have cerebral edema, they can have headache, they can have visual disturbances, like when the edema is more, it can cause visual disturbances. That is cerebral edema. When the individual have macular edema, they will have characteristically presented visual disturbances, vision will come down, which is many times commonly because of diabetes retinopathy. That can be one of the common cause, especially in Indian setting or anywhere, because diabetes is being so common. That is called as macular edema. So these are the causes of edema and types of edema and the clinical features of edema. So when it comes to management, investigation depends on the type of edema. Suppose if we are expecting renal failure, we need to do some basic tests like urine examination, where you can see protein in the urine, or other findings like RBCs in the urine. You need to do renal function test, like simple test like you can do urea and creatinine, which can be elevated, again suggestive of renal disease. Similarly, when you are expecting liver dysfunction, you can do liver function test, where you can do liver enzymes being elevated, bilirubin being elevated, and supportive investigations for kidney as well as for liver. You can do sonography, and you can see the altered liver texture in case of liver disorders, especially in the cirrhosis of liver. And in kidney diseases, you can see various structural changes in the kidney, depending on the type of etiology. This is about liver, and this one, what you can call as renal problem. Cardiac problem, you need to do basic investigations, depending on that, what is that echocardiogram, ECG is required. And sometimes heart failure enzyme need to be tested. Basics are ECG and echo sometimes can give most of the information. Detailed investigation depending on the findings. So, protein estimation in the liver function test can again give you a clue to the findings called as hypoproteinemia, which can be picked up. That can be one of the common cause of protein energy, protein deficiency, which can present with edema. Other investigations, depending on the cause, when you are expecting trauma to the limb, cellulitis, you can pick up by the sonography. And depending on the other parts of the edema, like the brain edema, you can pick up on investigations like MRI, if that is required, depending on that. And similarly, macular edema can be done by the picked up by the fundoscopic examination. So etiology, depending on that, you can do the tests and evaluate further. That is for the edema. Coming to the management depends on the underlying etiology, definitely. Like edema can be seen in pregnancy, which usually comes down by itself once the delivery occurs. Edema will usually come down. Local causes of edema, like bite of the insects, or some insect bite can cause local edema, that will be usually responding to antihistaminic will be sufficient. Some other causes of edema, like pedal edema, can need diuretics. The cardiac problem, like pulmonary edema, also require diuretics. Renal problem, depending on the fluid accumulation or pedal edema, diuretic usage will be helpful. Along with that, you need to do some advices, simple advices like restriction of the fluid, restriction of the salt, and that's what is going to help along with other drugs like diuretics. Liver disorder, again, diuretics will be helpful, but again, you need to address the causes of underlying liver disease so that the edema can be managed effectively. Cardiac evaluation need to be done and managed accordingly. Correctable causes, underlying cause of edema, pulmonary edema, or congestive cardiac failure. So when it comes to edema, we need to say in totality what is the exact cause and how to approach depends on the underlying etiology. This is in brief about pedal edema, or what you can call as edema, and various etiologies, how to approach them, how to manage them. Thank you.